Good evening. I'm Nora Lopez, President of the National Association of Hispanic Journalists. Welcome to our webinar, COVID-19 Equity, Vaccines, and the Long Road Ahead, in partnership with the American Medical Association and our esteemed ally, the National Association of Black Journalists.
Thank you for joining us. I'm Dorothy, President of the National Association of Black Journalists. There are legitimate concerns about the speed of COVID-19 vaccine development and the influence that politics may have played in the process. Add that to the deep-rooted mistrust of science and medicine by communities of color that have suffered the consequences of long-term systemic racial disparities in healthcare and historic medical abuse. And the conclusion is a refusal by some to take the vaccine, a hesitation by others, and many more who have questions. Our jobs as journalists to answer those questions. Both NABJ and NAHJ have been at the forefront of dialogue and advocacy, tackling the root causes of perpetuated inequity and making sure our communities are informed. In developing this discussion, the AMA and our two journalistic organizations needed to bring impartial sources to reporters and editors. Still, the most paramount concern is sharing the best access and communication methods to ensure much needed information reaches underserved communities. Our struggle is far from over, but we will overcome this moment together by dedicating ourselves to the pursuit of truth and information justice. Again, we thank you for taking the time to join us.
Thank you, Dorothy. It is vital for NAHJ that we continue these discussions to ensure that journalists have access to authentic and verified sources and reports on COVID-19 and vaccines, especially in these times of rampant misinformation. The consequences have been catastrophic for those marginalized communities who are deprived of a robust communication. And from the beginning of this pandemic, COVID has spotlighted the nation's systemic inequities through its disproportionate impact on Black and Brown populations. In October, AMA released a report examining the existing inequity driving Latinx COVID-19 impact. And it showed that Latinx individuals make up 18% of the US population, yet represented 33% of COVID-19 cases. Similarly, in New York, Latinx individuals made up roughly 19% of the population, but accounted for 34% of the COVID-19 fatalities. Further, the racial disparities and underrepresentation in clinical trials pose a threat to our community's recovery and for a path forward. We're proud that our own past NHJ president, Brendan Benavides, stepped up at a crucial moment in our nation's crisis and participated in the Moderna vaccine trial. We continue to have a unique opportunity to serve and connect knowledge with action for equitable healthcare. And now let's meet our panelists. First, Dr. Lily Immergluck. She's a professor and physician scientist at Morehouse School of Medicine. Dr. Immergluck has spent over 20 years studying antibiotic-resistant infections .
Are you introducing, Nora has dropped out, or am I frozen, or goodness, this is where we're at these days, isn't it? All right.
I think she might have froze.
I think Nora froze for a moment. Let me continue introducing the rest of our panelists until Nora gets back here. We have Dr. Ricardo Correa, Director of Diversity at the University of Arizona College of Medicine in Phoenix. At 6 years old, Dr. Correa already knew what he wanted to do with his life. He wanted to help others through medicine. Never straying from his dream, Dr. Correa is a physician, a researcher, educator who is helping advance the field of pronounce it for me. What is that field of?
Endocrinology.
Endocrinology, thank you. Through his work in creating education programs, he has increased literacy about healthy habits and believes health literacy is not just speaking the same language, but understanding the culture, as this may indicate if an individual's habits are healthy. Also joining us, Dr. Susan Bailey, President of the American Medical Association. Her long history of service in helping guide organized medicine extends to the local and state levels as well. She has served as board chair and president of the Tarrant County Medical Society and as vice speaker, speaker and president of the Texas Medical Association. Dr. Leon McDougall, president of the National Medical Association. Dr. McDougall has been a family physician on the Near East Side of Columbus since 2001 and believes that lifestyle must be a focus of both the treatment and prevention of chronic diseases such as diabetes and high blood pressure. His research is focused on diversity and inclusion and eliminating health disparities. He is a diplomate at the American Board of Family Medicine, a fellow at the American Academy of Family Physicians, and a member of the Association of Military Surgeons of the United States. We'd like to invite Dr. McDougall and the rest of our esteemed panelists to first give us an overview of the state of the vaccine. Where are we today from each of your perspectives in vaccinating Americans? Dr. McDougall, can you please start?
Thank you, President Tucker. So I would like to focus on a survey by the Kaiser Family Foundation where they noted that in September, the willingness of the Black community to receive a COVID-19 vaccine was 50%. The good news is that in December, that improved to 62%. And also in December, however, 35% definitely did not want to receive the vaccine. So it makes these town halls and convenings such as this evening very important, and the role of the National Association of Black Journalists and National Association of Hispanic Journalists puts that responsibility in collaboration and sharing news with our communities as vital and critical. So from a standpoint of the National Medical Association, we've released an advisory statement on COVID-19 vaccines, namely the Moderna and Pfizer vaccines, looking at those vaccines from the perspective of the Black community. I would highly recommend that audience members download that document that was produced by the National Medical Association COVID-19 Task Force on Vaccines and Therapeutics. And we are supportive of the emergency use authorization by the FDA for both vaccines.
Thank you. Dr. Bailey. You are muted. We need you to unmute, Dr. Bailey.
Sorry about that. My screen just went nuts, but here I am. Thank you so much for for joining us today and for allowing us to host this very special event. It has been nothing short of amazing how quickly we have gotten to this point, not only in the terms of the devastation of this disease, but in the progress of vaccine development. Operation Warp Speed, in less than a year, actually it was exactly a year ago this week that the initial sequence of the virus was sent to scientists to start developing a vaccine. And now almost 10 million people have been vaccinated. I think it's important to understand that no corners were cut in developing this vaccine. The red tape was cut and the money was flowing in, but no corners were cut scientifically. And I'm very pleased that the companies, Pfizer and Moderna, really tried very hard to make sure that diverse communities were involved in the vaccine trials. But here we are, and the rollout of the vaccine has been a bit bumpy for a number of reasons. There is, first of all, the approval came right before the holidays. I think a lot of communities were really not prepared, and the communication between the federal government and local communities has been spotty at best. And so the AMA is now asking the Biden administration to make sure that there's a national strategy for vaccine distribution, and to provide states and local jurisdictions with the additional resources, guidance, and support that they need to be able to get those vaccines in people's arms. Every community is different, and we're hoping that the administration will listen to all these various communities and hear what their special needs are and do what they can to try to help them roll this vaccine out as quickly as possible.
Thank you. Dr. Correa.
Yes, and I want to echo Dr. McDougall and Dr. Bailey. So the process up to now has been a big step in medicine. Having a vaccine just launching in less than a year with all the scientific evidence behind it has been very good. We will remember this day for forever in medical history. So something important is that, as Dr. Bailey mentioned, the rollout has been slowed down in certain places. And one of the things that we really consider is the underserved population, and especially the undocumented population that has been having some effect on this. One is that at this point, there are certain states that doesn't know how do we will enroll this undocumented population in the vaccine. Other states have been more proactive and already starting the process. So that's something that we need to watch out with the next administration to make them understand also that this is a public health problem and the documented populations are part of our nation. The other important thing is that we need to use acculturation, not just language translation of the information, but also acculturation, changing to understand the culture of these underserved communities, because sometimes when we just, and this is what is happening right now, that there is translation of many things, but there is not really cultural appropriate for these communities, and the message is not getting there. We still have a lot of work to do, and I hope that in collaboration, physicians and journalists can make this a big change, and we can contribute each other so we can really give the message that is appropriate for those that need it the most.
Dr. Correa, is he frozen?
No.
Is everybody frozen? Just, is anybody frozen? Okay, Nora and I are just, having serious issues here. And mine was just really well today. And my apologies. I think we are okay now. Let me encourage, we're ready, before we hear from Dr. Irma Gluck, let me just remind those who are watching that we definitely want your questions. So please prepare your questions. I know I've got a number of questions. I don't want to hog everything. So this is an opportunity for our journalists to ask questions. Dr. Irma Gluck, please, your perspective. Irma Gluck.
Okay, thank you. So I'm going to give you the perspective of someone who's a primary care physician, a pediatric infectious disease specialist, and also a researcher who is heading our effort at Morehouse School of Medicine in the participation in the U.S. COVID Prevention Network as part of the vaccine clinical trials. I think one of the things that I would like to get across and also answer questions is the importance as we try to understand the different vaccines that are coming up through the pipelines and why it's important that we continue the effort at every level that we can to accelerate and get these other vaccines that are in these clinical trials out there so that we have more available doses for our country and get more people who are unable, or the different priority groups. I think for the general public, it may be a little confusing when we say COVID 19 vaccine is available, and to help discern what does that mean as far as why should they continue to participate in the vaccine clinical trials. And then the other issue that people before me have already touched upon is also something we struggle in Georgia, the distribution by the priority groups that were previously outlined. We recognize now that the distribution of these doses are, not going to be able to get everybody to that herd immunity that we would like. So how do we get there, and how do we adjust the distribution now that the vaccines are now on the ground and going to the different areas? I think it's important for us to understand that and then communicate that out to our communities. Thank you.
Thank you. But I'm going to let you stay there for a moment, because you talked about the different vaccines that are in the pipeline. How many are we talking about? And, what are some questions that journalists should be asking? And who do we ask these questions to find out, what vaccines are out there and where are they in the process?
So the vaccines, the biggest impact, I think, of all of this is Operation Warp Speed, which I don't know how many folks in the general public realizes, but this Operation Warp Speed is built on a unique partnership between our federal government and our private industry through these various pharmaceutical companies that have these vaccine products in development. And so in that effort, there's a lineup of following the procedures for vaccine development that we always follow: phase 1, phase 2, phase 3 you hear about. So what the federal government has helped to do is mobilize different sites across the US and internationally, so that for any particular vaccine, they, instead of like struggling to get, X number of sites, they help them accelerate the number of sites participating in these trials so that we can get the 30,000 participants. And then from that information, we can understand the vaccine efficacy. So all of these different vaccine products are coming up through the pipeline, and development are going in the same process that Moderna and Pfizer had to go through. And the goal is that we get them to that phase 3 and complete that phase 3 so that we can analyze for each one of them the vaccine efficacy, if that makes sense.
It does. No, that makes perfect sense. I'm just curious, are we talking, I remember the news when they were talking about Moderna and Pfizer, and then there was the Oxford study, the Oxford vaccine. Are we talking a handful of more, 6 or 7 more that are out there, or 20 more? And are you saying that we still need people to participate in the trials?
We absolutely still need people to participate in the trials. We are using, for example, right now in our clinical vaccine trial site, we are recruiting for Novavax is the vaccine sponsor. And that's a different platform, with the goal, though, still targeting the spike protein as far as making our immune system aware and alert to that, just like the mRNA is a different platform, but it's also trying to make the spike protein so that our immune system recognizes that piece to generate the antibody response. So, that there are different vaccine companies that are making different products, right? And then they're going through the different phases. Right now, where all our focus is on the ones that are getting prepped for phase 3. That's the phase that really gives us that information and to talk about vaccine efficacy.
I'd like to.
I'm going to take this question now, and
I'd like to.
Dr. McDougall, please, yes.
Okay, so our National Medical Association Vaccine Task Force, right now we're meeting with AstraZeneca, also Johnson & Johnson. Both of those vaccines are using an adenovirus vector platform for the vaccinations. Dr. Emmer Gluck spoke to the Novavax that's being trialed at Morehouse, and there is another vaccine coming out by Merck. The Merck vaccine is not supposed to go into phase 3 until maybe in the fall. So the 2 vaccines now, one by AstraZeneca, it is a 2-injection vaccine, And then the one by Johnson and Johnson is a Janssen called Janssen vaccine. It is a one-dose vaccine. So those are the two on deck right now, uh, with the phase 3 entering the phase 3 completion of the vaccines. And both of those do not require ultra cold temperatures. And it's thought too with there's about 6 or so in total. There are more worldwide, but as far as Operation Warp Speed and so forth, and it's thought also that with following outcomes with vaccinations, we may find that some of the vaccines work better in certain populations, and there may be less allergic reactions to certain vaccines. So to have these in the pipeline and available through emergency use authorization, and also ensuring that a diverse enrollment of participants, this will allow us to take that information and maybe be able to say, well, this population, this particular vaccine is better, or if you're in a rural community, may be more available, et cetera.
Thank you. Nora is back. Nora, I'm going to let you catch up for a few minutes as we chat, and I'm glad you're back on. Dr. Bailey, you mentioned something early about herd immunity. Given, what Dr. McDougall and Imra Gluck is saying about 6 or so vaccines out there that are kind of prominent, and then there's so many others that are being worked on. When estimation and time, if you can, when we might have herd immunity?
Oh boy, this is the $64 million question. We are hopeful that we'll be able to reach herd immunity, if the vaccine distribution and administration, continues to proceed. Sometime, I know Dr. Fauci has said, perhaps sometime this fall. It's really, it's important to understand that herd community it's not like a definite cutoff point where a switch is flipped and then all of a sudden we're all safe. It's a continuum, it's a spectrum. There's some aspects of herd immunity that we need to remember. We now know that people that have had coronavirus actually had the infection maintained for their immunity for at least 6 to 8 months and maybe longer. So that's going to contribute to herd immunity to a certain extent. The individuals that get the vaccine will contribute to herd immunity to a certain extent. But I think it's important to remember that children are not included in the vaccine trials, and or at least have not yet. And Pfizer is currently looking at ages down to age 12. But younger than age 12, there are really not any immediate plans for vaccine administration in that population. And that's a significant percentage of our population. So, we're hoping that we'll get there later on this year, but it's all going to depend on adequate cooperation of the federal government with the state and local authority, as well as other jurisdictions like the Indian Health Service and the correctional system. As well as being able to combat vaccine hesitancy to make sure people feel comfortable getting it in the first place.
Yeah.
Dr. Bailey,
Go ahead, Nora.
I wanted to follow up on that because you talked about people develop an immunity to it, but I've heard of cases where people have had it, gotten better, and then got it again. Is it that they basically never got over it to begin with? Or is it?
That's a good question. And researchers are studying that very carefully. It's just been a handful of cases that have been described, and it looks like those folks actually are getting it again rather than not ever getting over it. And we're still trying to figure out why. Is it because they didn't develop adequate immunity in the first place? So we're susceptible. Is it because they got a different strain? We're just now starting to understand that there are different strains of the virus out there, some which are more contagious than others. So we're still learning about that. But I think the good news is that there have been so many millions of cases around the world, and only a handful of documented cases where people appear to have become reinfected, that in general, we just don't think reinfection is going to be a major issue at all.
Now, someone mentioned about needing to have a nationwide, I think it was you, Dr. Bailey, who talked about a nationwide response. But Dr. Correa, how would that help? How would that improve getting the information out about vaccines, especially to underserved community, especially to the Latino community?
Yes, so something that is very important is that reaching out, it's a public health problem. So it's everybody involved. So reaching out to these communities that are underserved, that they don't get so much access to many of the things that the other population get access. It's very important. For example, when we think about Latino community, something that I want to mention is that there is a lot of cultural issues that are involved. One is they believe a lot in the family, like my grandma, in Spanish we say abuelita, what abuelita said, it's very important. So they are coming with the idea, grandma is coming with the idea that there is protection, that there is, if you take a tea, will help you instead of using the vaccine, that the vaccine, and because this is the way that the culture is, the people are not thinking right now and injecting the vaccine. So we need to change that. At this point, abuelita have no experience with the vaccine or the coronavirus because this is so new that nobody have experience in the past with this. So we have to reach out to that population and tell them this is the evidence and this is what we have, and then make it better. The other thing is that this is a global pandemic. So even though our effort should be in the US, there is also the probability that people fly every day, and then this can contaminate. If you don't treat the entire world, that is also this will continue. So the hope is that everybody is doing a great job up to now. The vaccines are being produced, and as Dr. Bailey mentioned, probably by the fall we will be able to at least return something similar to normality. But
Normality, you speak of that, and Nora, I'm going to let you read the questions in a minute, and give you some time to look at the questions, because we do need to go to questions now. And thank you to our members who are watching, and to others who are watching and have posted questions. Nora's going to get to those in a second. You guys were talking about getting to a normality, but here's my concern. If you have a percentage of people who are hesitant, a percentage of people who say, hell no, a percentage of people who are not being reached, because of either a language barrier or because of culture, or because the information is just not getting to them. What's the impact of that? And isn't that just really going to make it longer before we get to the herd immunity? And for example, if we have the Latino community and we have that good percentage that are essential workers, and yet and still they're not vaccinated, I'm just kind of wondering, how do we ever get to a point that this thing ends? Any of you jump in on that and help me out here.
Well, so from my vantage, I think that it is for us talking to the communities that the lay folks trust. So talking to providers, I try at different opportunities to talk to our community physicians, community hospitals, because they need to hear the same messaging. And that's where patients go to. I mean, if you have a concern, who do you go to? You go to your primary care doctor, or you go to somebody you think would give you guided information that you would trust. And so we need to speak to the healthcare workers, the community health workers, people who are in different community-based organizations, to give them the information, which they then can in turn give to their community. And I think it's through that mechanism of spreading the word that's consistent, that will reassure people that this indeed is fact-based, science-driven information. So, I mean, that's just my perspective.
And I want to echo Dr. Immergluck because I think that community healthcare workers are vital in this process. So what we are doing, for example, in here in the clinics that I work, it's start training those community healthcare workers with good information so then they can spread the word among the community. This is people believe on them, believe what they say. So that is very important. We saw that at the beginning of the pandemic, where there was a lot of misinformation. The best way that we used to communicate with them, because these are people sometimes that they don't have internet, they don't have social media, they probably just have a phone. So the best way that we use was through the community healthcare workers that were going into the houses, into the community to spread the word. So that will be.
Because that's what I was going to ask Dr. McDougall. You said it. You started off at the willingness of 50%. You got it up to 62%. So how'd you get that 12%? Was it through community activists helping to spread the word, or any other secrets you can share?
Well, I don't think it's so much of a secret. We can reflect back on history and look to Reverend Dr. Martin Luther King Jr. in his book entitled, Where Do We Go From Here? Chaos or Community? And he speaks to pillars in the Black community that build coalitions to address these difficult problems. And those coalition members include the Black church, the Black press, Black fraternities and sororities, and Black professional organizations. So that's what we have done. Dr. Reed Tuckson has brought together the Black Coalition Against COVID, involving the consortium of 4 Black medical schools, Howard, Meharry, Morehouse, and Charles R. Drew, the National Black Nurses Association, the National Medical Association, the Montague Cobb Health Institute, the National Urban League, and blackdoctor.org.
There's a long list. Okay, I get
Long list.
It's
A long
lot
list.
of people. Okay, I'm gonna stop you because Nora's got some questions that she needs to ask here. Go ahead, Nora.
I've got questions from some of our participants, but I did want to note real quickly that, adding to all of this is also the digital divide that I know in San Antonio, they've had a big response to the vaccines, but they actually opened up 2 sites over the weekend where they said, we're not going to make online registration available. It's strictly phone. You've got to call in and register by phone in an attempt to give people who don't have, smartphones or tablets to be able to get in. But even that was a disaster. They had 2 lines, 1 line of people who were in line still calling and trying to get in. So there's a lot of challenges, and just wanted to see if anybody could speak to that and then jump into some of the questions that people are asking. Maybe Dr. Correa.
I'll jump in. I think that the San Antonio example illustrates the importance of each community having very different needs and needing help from the federal government to make sure that their unique situations are being taken care of. Every community is different, and there are some people aren't going to be able to get to a pharmacy once these things are widely available in pharmacies because of lack of transportation. Some people in rural areas. I talked to a patient yesterday Even though I'm president of the AMA, I still see patients. And she lives in a rural county in West Texas. And there was only one small pharmacy in the entire county. That was the only place where you could get a vaccine. And so she was trying to figure out what the heck she was going to do. Obviously, a very long waiting list. And so it's an interesting situation right now where we have an incredible crush of folks that want the limited numbers of vaccines that are available at a limited number of sites. But as time goes on, I think we're going to be dealing more with trying to convince those that are hesitant to get the vaccine. And hopefully that will become easier and easier to do once our hopefully successful story is able to be told.
Thank you, Dr. Bailey. I'll go ahead and jump into some of the questions from our participants. This one comes from Renetta DuBose, who says, as an African-American journalist, many in my community talk about their fears in taking the vaccine due to the Tuskegee experiment and the Henrietta Lacks. And she asks, what are some good messages to put in stories to help break down government healthcare trust issues among Black people?
So I'd like to take that one. So
Thank
I referenced earlier the National Medical Association Task Force on Vaccines and Therapeutics. This was a group of infectious disease specialists, pediatric infectious disease, public health specialists, preventive medicine specialists. We came together, we met with the pharmaceutical companies, we reviewed the FDA and CDC Advisory Committee on Immunization Practices data. So we looked at the comparing the Black cohort against others in the clinical trial. We did not see any significant differences in regards to the serious adverse events. So that's what led us to support the emergency use authorization for both the Moderna and Pfizer vaccines.
And also,
Thank you so much.
Go ahead, Dr. Carrera.
yeah, so if we talk about also about the Latino community, if we look at the data from the studies there are studies that include 20% of Latinos. So that is a very reassurance that including the underrepresented minorities are included in these trials. So that's why, as Dr. McDougall mentioned, it's an effort. This is nothing to do with conspiracy theories, something that we are not going to involve. The pharmaceuticals try to involve as many as diverse population in these trials, and then the data that we have right now include those populations.
Okay, I'm going to go back to a question for Dr. Emmer Gluck. This person wants you to comment on the difference between efficacy and effectiveness with the vaccine.
So vaccine efficacy
Efficacy.
is related to the reduction in disease. So if you look at what was reported by Moderna and Pfizer, they reported that their target endpoint when they designed these studies was to look at prevention of moderate to severe disease caused by SARS-CoV-2. And in looking at that, they saw that when they, who got placebo versus who got vaccine, that those who got vaccine actually were protected more so than people who got placebo as far as moderate to severe disease. They couldn't really make a comment about anything other than that at this time. You know, so data is forthcoming again because we still care about the mild and asymptomatic people who are infected. But when they designed the study, they were looking at moderate to severe disease, and they had criteria for that. Vaccine effectiveness is really looking at how well does this vaccine work in general in a large population. That distinction is important because the efficacy is tied to a particular outcome that you're wanting to see, whereas effectiveness is how well does this vaccine work in general in mounting an antibody response, if that makes sense.
It does make sense. My question while Nora is still looking at some other questions, and this is to all of you. As journalists, what are we missing? what should we be asking, and who should we be asking these questions to? What don't you see that just drives you crazy, that you say, I wish a reporter would cover that. I wish a reporter would ask that question.
Okay.
Dr. Maduga, you raised your hand, but don't give me a real long answer, okay? I love you, dear, but
So social media, the influence of social media on mistrust. That's my answer.
okay. I'm sorry. What do you mean by that? You got me on that.
See,
I
better
said,
shut
don't
a
give me a
brother
long
down.
answer. Now you're teasing me. Okay, give me more. Give me more.
So there are YouTube videos and so forth that are on social, being distributed via social media, and really causing a lot of anxiety, especially in the Black community, and I think also among younger folks. And these videos are professionally produced. You almost have to have a scientific background and decipher what's true and what's not. Just as Twitter was used to influence our political climate, I think there's an underground pathway here where mistrust is being engendered through social media.
Wow, I can see the reporters now. We're talking a fact checking story. You know, let's finally say this is what's out there. This is what's wrong. This is what's out there. This is what's not true. All right, the rest of you weigh in. What do you want to see? What kind of stories you want us to see you do, Dr. Bailey?
Along those lines, and this may not be the type of story, but the way the reporting is done, it's really easy for a news story that was designed to catch someone's attention. It inadvertently fuels vaccine hesitancy, even though it's not a conspiracy. That's not what they were intending to do. But when you make a big deal out of a very small number of patients that are having certain problems. One of my pet peeves is showing photos of needles and people, actually getting shots put in their arm. There are a lot of people that are scared to death of needles, and we can't get over the fact that yes, you do need to get a shot to get a COVID-19 vaccine. We don't know how to give it any other way yet. But if you reinforce that fear in someone's mind about a big old needle, which it's not, it's really small and doesn't hurt at all, that unintentionally fuels vaccine hesitancy. And so I think it's important for reporters, journalists to give a second thought about the impact of that story on someone who really is looking for a reason not to get the vaccine.
Wow,
I'd like
interesting.
to have the journalists delve into the distribution issue. I think that's a key point now, because some predictions that were made earlier on about how the 100 million doses were going to be distributed from the federal level to the state levels. I hear, no more than what other people are hearing through the news channels and other social media feeds about it was going to be based on the state in some formula calculation, but it's never been really clear about how that's gone. And then from the state level, the disparities that happen down to the local level. So, for example, I have elderly relatives in Michigan. I'm talking 90 plus who are unable to get on a list to get vaccine. But we at Morehouse School of Medicine, we have our parking deck, because we are turning that into a vaccination center to give to people who are 75 and up an opportunity to come through and get a drive-through vaccine. And so again, what I'm asking for some clarity is, what is the mechanism? What's the way that we can communicate so people understand this distribution issue? Because that's going to become more and more of an issue as time goes by.
Thank you. Dr. Correa, you're last.
Well, so something that on the way of the distribution is, I would like to know how different states are dealing with the undocumented population, because we know that some are doing better than others, and then the plan is different from state to state. And then when a journalist is there and making pressure that everybody gets the vaccine, then probably things are going to change in the local governments. So I would like to know about that.
Nora, you got a question? You're on mute, Nora.
Yes, I do have a question from one of our participants and sort of related to the topic that we're talking right now about vaccines. He's from Indiana, David Welsh, and he says that in Indiana, they've been allocating it on a percent population per county. So if one county doesn't use all of their doses right away, they are redistributed to other counties with a higher demand. And he's wondering if this strategy is being used elsewhere. And if there are issues with delivery processes that not being robust enough in certain communities.
I'll take an initial stab at that one. Every state and federal jurisdiction had to submit its own distribution plan to the CDC in October. And so every state is doing it differently. And one of the issues in distribution, of course, the Pfizer vaccine, the first one that came out, has to be stored at ultra cold temperatures that most facilities don't have. And so it's very difficult, and it's only delivered in lots of 975 doses. That's the smallest amount that you can give out. So if your vaccine distribution is based on population, and you have to deal with increments of essentially 1,000, it's easy to see how that might not work in smaller communities, and vaccine might go to waste, which would be a terrible tragedy. But actually that's a story that I would love for journalists to look at. It's like, well, what's happening in our state with vaccine that's not being used? What's happening? Are vaccine doses being wasted at the end of the day? Are they having to just find anybody to give it to so they don't have to throw it away? I think we need to know about stories like that to see where we could do better in terms of distribution.
Because I'd like to know, I know there was a case here in Chicago, there was a hospital and 40% of the staff, it was predominantly African-American hospital, 40% of the staff said, no, we're not taking it. And so they were calling people in, quick, come here, take this vaccine so that, it wouldn't be wasted. And that's, how do you guys, what are your recommendations? How are institutions, facilities that have the vaccine, how are they supposed to deal with that? What should they do? Y'all didn't freeze.
No,
Yeah,
so
that's the answer.
that's a good question. So I think part of that answer is the education part of it. So at my institution, we put together a video designed to help educate the staff. It also includes information from the National Medical Association that I've shared. So we're speaking to diverse audiences and explaining what the mechanism of action for the vaccine in an understandable way. So some of that fear is just from not knowing, and that's one of the methods.
Okay.
That'll lead us to a couple of other questions that are being asked that are sort of related. People are wondering, should they wait for more test trials to be conducted? There's fear that they've been produced far too quickly, and people are worried about the long-term effects. What would you say to them?
So if we think about something that people have a misconception is that the vaccine was produced in 10 months. So the studies of the ones that we have right now, the RNA and mRNA vaccines, has been more than 10 years. What we have now is there's like a template that you have, and then now you add something new that was the coronavirus part. But this vaccine has been studied for a long time in preclinical trials. So that's I think a misconception that it was, yes, the last part for the COVID-19, for the coronavirus now, it's was in the last 10 months. But really the mechanism, the template has been studied for a long time. And then with that, I think when I explain that to the patients, even the healthcare workers that are afraid of taking, they start be more flexible, and then they accept it.
Let me ask another question here, then Nora, I'll let you pop into yours, because this one was an interesting one to me. How real is the possibility that certain racial populations will not develop optimal immune response from the COVID vaccine? Is that a case of, is that real? Is that a case of misinformation?
So I would say, based on the phase 1, 2, and 3 clinical trials, we do not have evidence that would support that conclusion.
Okay, so that sounds like maybe one of those cases of, you talk about just kind of a misinformation that's out there that should be. Am
But
I
I
right?
I would also add that that's why it's important for all different races and ethnicities to participate in these vaccines, because even though we can say the effectiveness is going to be uh, you know, uniform or to a certain point for each of these vaccines, the efficacy, there's some, maybe there's some difference that will come out as we monitor over time the durability of the antibody response, the transmission. Once you have developed antibodies, does that protect you from transmitting it if you're exposed again? Those are questions we don't know for any of the vaccines, as far as I can see. But that's why it's important to keep participating in these vaccine trials, so that we can get a spectrum of vaccines that are effective, and recognize that there might be some differences in the efficacy of whatever the outcome we're looking for, and that's going to be only evident through time.
And could I also speak
is
to
this
this
a-
issue?
Well,
Could I
I
speak?
want to ask this one because we're almost running out of time, and I was waiting for this one. Is this what I'm about to say, is it fact or is it misinformation? If an undocumented immigrant goes to get the vaccine, are they risking providing their information and jeopardizing their family? There is fear, as I think you all know. Has the government set up a system, have the states set up a system that the undocumented can get the vaccine without fear?
That's a very good question, and I will tell you by experience in Arizona. So this cannot be replicated to every state, but in Arizona, for the vaccine, the state government is doing a very good job guaranteeing that even that you don't need a documentation or a driver license to get the vaccine. So you have to report certain information because you have to report to the CDC that you are using the vaccine or in a person, but you don't need to have documentation of documents to you don't have to be a citizen or permanent resident or on a visa here. So
what guarantee do they have that that information won't later be used against them? Because in order for you to get the vaccine, in order for you to get the second dose, you got to say, this is where I live, this is what I do, so what guarantee is the state providing a guarantee that, we're going to tear this up after you get your vaccine, or we're not going to use the information? Or
so what we are doing is that we are going to start vaccinating when the time comes in our clinic that see 99% of undocumented. So the clinic will be the center for referral for that. So it's not that your house or something, it will be, you come to the clinic, we protect all our patients in the clinic, and that's how we are going to report to the state.
okay.
Just want to make a comment about the vaccine trials. It's very similar. We're not requiring, a driver's license or other like formal identification. This was a point that, we asked over and over again from our site when we decided to participate as part of the U.S. COVID Prevention Network. So we did want to make sure, because when we go out to our community-based organizations, we wanted to make sure we gave them the information that's credible and they can rely on that as far as uh, trying to get folks to participate in these clinical trials from communities that were very concerned about the documentation of their residents.
Thank you. Nora?
Yeah, one of the other interesting questions that's been asked, do you guys believe that there's a possibility that employers will hinder non-vaccinated employees from working? And if so, do you think this would be an effective way of making people take the vaccine?
I think employer vaccine mandates in general are, a real possibility. And so I think that, every, business is going to have to decide that for itself. Hospitals and medical centers have had vaccine mandates in place for a long time. Making sure that all of their employees got the flu vaccine primarily. And if they were unable to, that they had to make sure that they really took extra precautions, or maybe not work during flu season. So, so that is, there's a precedent for that in healthcare, and it's entirely possible that businesses may decide that that's the best way to not only to keep their customers safe, but to keep their other employers safe. But that's also an ethical issue that I think that our society needs to discuss. We're already seeing people not being able to get on airplanes if they have a positive COVID test. What's going to happen when the vaccine is more common? Are you going to have to show documentation that you've been vaccinated to get on an airplane or go in a restaurant or shop at a certain store? We'll have to see how that plays out.
Yeah. We've got just a few more minutes. I'd like each of you to do closing thoughts, if you don't mind. And we'll start with the order that I think we had. Dr. McDougall.
Yes, so this is a wonderful forum. I just want to speak to herd immunity. Part of the importance about herd immunity is so that the health system isn't overrun. That still doesn't mean one can't catch COVID, especially with some of the mutations we're seeing that making it more transmissible. So I think so I would like to just share that. And the Black Coalition Against COVID website would be a very good source for people.
Thank you, Dr. Bailey.
I'm so grateful for this opportunity, and grateful to everyone for participating. And thanks to the National Association of Black Journalists, the National Association of Hispanic Journalists for having us. I think that so many of the things that we've talked about tonight are examples of how important it is for us to all work together, and that the actions of an individual can have profound effects on the population at large. And we can do this. This is not an impossible task. And I believe that we've got great minds out there that can solve the problems that still exist, that can fill in the communication gaps that we still have. This is the greatest public health challenge we have faced in 100 years. And I also think that we have the tools and the ability and the desire to overcome it. And I'm so grateful to have this opportunity.
We're going to make you wrap up, Dr. Correa, because we don't want to make sure we get everybody in. Thank you, Dr. Bailey. Dr. Correa.
So thank you so much for having me here in this panel with amazing doctors. So one of the things that I think that the key for all of this is education. So we need to educate ourselves, our healthcare workers, the journalists, the people in general. So if we have to take something, is base evidence and then trying to communicate that to all our communities.
Thank you. Dr. Immergluck. There you go.
Sorry, I used my 15 seconds. So just want to say vaccines don't prevent disease. And in this case, COVID-19 vaccinations do. I really want people to give vaccine trials a consideration. And if you need clarity, please go to your trusted community, whether that's your faith-based community or your primary care doctor, for fact-based information and data about what's happening in your community.
Thank you. Nora, I'm going to let you wrap it up. Mute, Nora. Unmute.
It was very valuable discussion. Apologies for my connectivity issues, speaking of digital divide. But I want to thank everyone. And thank you, Dorothy, for so seamlessly picking up on things. Thank you.
And thanks to all of you. Here's what we're going to do. You know, there are a number of links, resources, and I'm going to try and get that out on social media so that our members, the journalists, will be able to find that information. Thank you all again. Thanks to those who listen in, and thank you to the panelists. This was invaluable information. Everybody stay safe and have a good evening.